Well, good afternoon, everyone, and hello. It's 12 o'clock, so I'm going to get us started. Thank you so much for joining us at Compass Health's Town Hall, where we're going to be talking about our Phase 2 progress of our Broadway redevelopment. Just really quickly, we want to make sure we get everyone out at 12:30 today, so regarding Q&A, we are going to use the feature within Zoom. We will not be able to answer questions live today, but what we're going to do is capture all of the questions, and then we'll be sending out an email tomorrow with the recording of today's town hall and answers to all of the questions. So please feel free to use that feature, and we'll make sure to get back to everyone as quickly as possible. I would like to introduce our first speaker today. Tom Sebastian is the CEO of Compass Health, Northwest Washington's behavioral healthcare leader. Throughout his 34-year career, Tom has held many clinical and leadership roles at the organization, growing its transformational impact through community partnerships, outreach, and advocacy. With Tom at the helm, Compass Health is poised to continue its innovative, evidence-based approach to care, integrating services for mental health, substance use, and medical care to support the whole person. It's really my pleasure to introduce Tom, and I'll hand it off to you now.
Thanks so much, Tom. I want to first express my deep and sincere appreciation to each of you for taking the time to join us today. I very much appreciate that, and thank you. And I'm so excited to have this opportunity today to share with you information about the special and extraordinary role that Compass Health plays in how we are addressing some of the most deep and significant needs in the communities of our region, and providing an array of behavioral health services to our most vulnerable community members. I'm also really excited to share information about a transformational project that we are undertaking here in Everett to further strengthen our capacity to deliver outstanding behavioral health care to those who need it the most. The Broadway Campus Redevelopment represents a major step forward in modernizing our behavioral health care that we provide here in the region and, in fact, statewide. First, I'd like to share some information about Compass Health and our impact on the community. Compass Health is now one of the 30 largest nonprofit organizations in the Puget Sound region. After more than a century of innovation and service, we are now the leading behavioral health provider in our 5-county region. In 2021 alone, over 600 Compass Health team members served over 17,000 individuals across our 20 locations throughout Snohomish, Skagit, Island, San Juan, and Whatcom counties. As a community-based organization, Compass Health provides mental health care and substance use disorder treatment to low-income and homeless individuals, children, youth, families, adults, and older adults who qualify for Medicaid benefits. We provide a large array of services to all age groups at a variety of levels of intensity so that we can ensure when someone comes to us for care that we're able to provide the level of care that they need in that moment. And as they are with us, if their needs increase or decrease, we continue to meet them where they're at, either increasing services if needed or maintaining continuity of care as they move towards their recovery process. I'm always happy to talk about the programs that we offer here at Compass Health, but what's even more powerful is the impact we make every day, especially in this difficult mental health landscape, with needs that have increased even more with the strain of the pandemic. Most of you have been impacted by the pandemic yourselves, either directly your families, kids whose school experience has been disrupted, children with special needs that have gone unmet because of the inability to access care. And we know over time the effects of isolation and our disconnection to one another is going to continue to escalate the needs of our community in terms of their mental well-being. And so it's more important than ever that we create the capacity, the expertise, and the environments within which we can provide that care to everybody that needs it. As you'll see here, our work prevents crises and homelessness. Our work keeps people in their jobs. Our work enables families to remain intact and integrates with the work of law enforcement and other community partners. Our partnerships with others in the community are a hallmark of who we are as an organization. And those partnerships enable us to move forward to comprehensively meet the needs of those in our community that have the most complex behavioral health challenges. So now to tell you more about just how we benefit local communities across Snohomish County, in addition to the 4 other counties that we serve, I'd like to introduce to you our Chief Operating Officer, Stacy Alice. Stacy's been an amazing leader here at Compass Health for over 20 years, and I'm so proud to work alongside her every day. She's responsible for the continuum of clinical services that we provide here at Compass Health. Welcome, Stacy.
Hey, thank you, Tom. And hi, everyone. I'm really glad to be here today to talk to you all. So one of the most important aspects of Compass Health's care delivery is that we provide community-based treatment. This allows people to receive help where they are and where their support networks are. None of us want to leave our communities in order to get care for any of our healthcare needs. And we know that timely treatment improves the overall health of our communities. The CDC estimates depression alone causes 200 million lost work days each year across the US. And we know that poor mental health can lead to poor physical health outcomes. The World Health Organization's demonstrated that people with severe mental disorders on average tend to die earlier than the general population by 10 to 25 years. And the majority of that mortality is due to chronic physical medical conditions. So we're all about getting people the right level of care right now and supporting them as they move through different levels on their way to recovery. In 2021, we served 2,415 adults and 1,051 children and youth in Snohomish County. The ages of those individuals ranged from 1 to 100, no joke. Like, we really had 1-year-olds and we had a 100-year-old. And we're treating all sorts of diagnoses, including major depression, generalized anxiety, PTSD, bipolar disorder, schizophrenia, acute stress disorder, adjustment disorders, separation anxiety, oppositional defiant disorder, ADHD, agoraphobia. The list goes on, right? There are lots and lots of, there's lots of need in our community for these supports. And so I'd like to share with you a particular story of one of our clients who's given us permission to share his journey. We've changed his name, but otherwise the details in this story are all reflective of his experience as he shared it with us. So Bob is a 29-year-old African-American male. He has a long history of behavioral health challenges beginning as a child. His current diagnosis is schizophrenia, and he also has a history of significant cannabis abuse and was diagnosed as cannabis dependent in the past. This use exacerbated his psychiatric symptoms. Bob has a long treatment history with Compass Health. He started in our children's services and has resided at our residential treatment facilities. He didn't succeed during his first 2 residential stays, but his last stay at Aurora House was successful, and he was able to successfully transition from Aurora House to our PACT team in October of 2015. He had a history of at least 10 psychiatric hospitalizations prior to being served by the PACT team. Since enrolling with PACT, he's had only 1 psychiatric hospitalization, just 2 months after enrollment. And since December of 2015, he's had no further psychiatric hospitalizations. He's gained sobriety while working in PACT and has been clean and sober for 2 years now. So how did Bob achieve such significant progress with his recovery? Well, there's multiple factors, not the least of which is Bob's own perseverance and resilience. In addition, Bob was able to benefit from the intensive services offered by the PACT team, which provides behavioral health support 24 hours a day, 365 days a year. And through this program, Bob's been able to receive daily medication monitoring and daily contact with the PACT staff. Even while on medication, Bob continues to experience significant symptoms of psychosis, but his symptoms are better managed now, which enhances his quality of life. Another key component of Bob's ability to reside successfully in the community and avoid hospitalization is the Snohomish Triage Center, which is co-located with the PACT program and other outpatient services at the Compass Broadway site. The Triage Center offers Bob an alternative to the hospital when he's having a behavioral health crisis. The PACT team can assist him with a brief, voluntary stay where he can work on stabilizing in a safe, fully staffed environment. The co-location of the PACT team and Triage allows PACT staff to see clients during their stay, daily if needed, for additional support. His PACT psychiatrist has met with Bob in Triage on multiple occasions, and that co-location has also increased the opportunity for collaboration of care with the Triage staff. Bob regularly uses the Triage Center when he has an increase in symptoms or needs extra support. He's had at least 15 stays at the Triage Center, most of which last about a day, sometimes 2 or 3. And easy access to the program, along with coordination with his PACT treatment team, means Bob's able to avoid lengthy and costly hospitalizations. Bob recently was able to move from a clean and sober house into Andy's place. It was a wonderful opportunity. He was so excited to move into his new apartment. The supported housing services provided by staff at Andy's place, in collaboration with the PACT services, will further assist Bob in his recovery journey. He reports he's pleased with his Andy's place apartment and has new hope for the future. And as Andy's place is part of the Compass Broadway service complex, the services he needs are just steps away. I hope Bob's story gives you just the smallest glimpse into what's possible when clients are able to move along a continuum of care in the same environment with a unified approach within their treatment teams. Thanks. Tom, over to you.
Thanks, Stacy. What an amazing story. And it's so reflective of so many stories, those that we serve every year here at Compass Health. So thanks a lot, Stacy, for sharing that with us. So now I'm really excited to be able to share with you more specific information about what's probably the most transformational project we've undertaken in our history here at Compass Health. As I mentioned earlier, we have been serving the community for over 100 years. So when we say this is the most transformational project in our history, it's really saying something. And that is our Broadway Campus Redevelopment. We are in the second phase of transforming an entire city block in Everett's core to create a state-of-the-art facility for behavioral health care in our region. This year, we'll begin demolishing the Bailey Building. The Bailey Building is an outdated, repurposed nursing home that has long outlived its usefulness. While the Bailey Building has served us so well for so many years, the truth is that the building was not designed to provide the sophisticated care to community members with such complex behavioral health needs. And so to be able to move forward and transform that city block and design it for the purpose of providing those services is so exciting for us here at Compass Health, and really is part of the next chapter of our organization moving into the future. So in the place of the Bailey Building, we plan to build a modern, efficient, attractive, clinical and operational facility with 72,000 square feet of space. And as you'll see in some of the renderings, it's going to be just beautiful. You'll also see that the sophistication of the building's aesthetic and functional design fully represent that sophistication of care that we'll provide there. And so importantly, it will reflect the respect and dignity that we feel for those that we will provide care for at that site. In addition, we also know that our staff that will be working at that site will be proud to work there and also feel that sense of dignity and respect in their workspace. Along with that, we also know that the building aligns with the efforts to transform the aesthetic of Everett's core, and it will elevate the area for neighbors and local businesses. This is a really important part of the project And we feel a strong sense of commitment to really make sure we meet this civic improvement here in the city of Everett as we continue to develop such a much needed facility. So the focus of the facility is to provide intensive behavioral health services to address the most complex and visible needs of our community members, including the current landscape in Snohomish County that again has been exacerbated due to the pandemic. So I want to talk a little bit about what will occur within the facility once it's completed. The facility will house a 16-bed involuntary inpatient evaluation and treatment center, or what we call an EMT. This facility is a resource for the most intensive level of care that we provide in the community, and there are currently not enough beds to meet the demand. What that means is when an individual and a family go through a traumatizing experience of needing this most intensive level of care, they're often having to leave our community, leave their family, leave their connections, and it just further traumatizes the experience. And so we are very excited to be able to create this additional capacity for this much needed level of care. We will also have a 16-bed crisis triage center. The triage center is available to all community members that are experiencing a behavioral health crisis. The center takes direct law enforcement and first responder drop-offs, alleviating the pressure on direct responders, first responders, to meet the needs of individuals who are experiencing a behavioral health crisis, enabling them to go back out on the streets, do their job, while we provide stabilization and care to ensure that these community members recover from their crises, are able to connect to ongoing services as they transition out of the facility. The facility will also house several teams providing very intensive levels of outpatient behavioral health care services. These are teams that provide outreach into the community, sometimes multiple times a day, in order to support community members in their recovery process and live independently in the community in order to thrive in their recovery process. We will also have offices for our crisis prevention, outreach, and community engagement teams. And so I hope you can see that the impact that the building will have is really the impact that we'll have through the services that we're able to provide. These programs are crucial to alleviate the demand on local resources, such as hospitals, such as law enforcement, and other community responders, and help clients avoid jail and unnecessary emergency departments or inpatient stays. So we anticipate in the facility that we'll be serving over 1,500 individuals with over 30,000 points of service. So this gives you some indication of the intensity of care that we'll be providing. We really need the facility to be able to match that level of sophistication of care that our staff are providing with the physical environment around them. Here's more specific information about the services and programs that Phase 2 will house. These are the exact kinds of services that Stacy mentioned in Bob's story. They are essential to help individuals like Bob stay out of environments like Providence's emergency room and prevent tragic outcomes and help those individuals pursue lives of hope and recovery. That's really what it's all about. Importantly, these services also help clients remain in their community, allowing for family visits, care coordination with other partner providers, and seamless transition to other services when they're ready to move to less intensive levels of care. The project's going to cost, currently projected to cost, around $50 million. And we're very pleased that Phase 2 has received considerable financial support from public and private sources. We've already received $5.5 million in philanthropic funding, which is just amazing. And additionally, we received $21 million from the state of Washington in order to support the construction of this facility. I'm really excited to share with you that additionally, U.S. Representative Rick Larson has just championed and secured $2 million in federal community project funding for our project. So we're able to now fully realize our vision and our dream, for that matter, to have federal, state, and local community come together to partner in making this much needed community resource a reality. We're so excited about that. It's an ambitious project on every level, but we know we can do it. And we've already seen great success in the first phase of our redevelopment project, which is Andy's Place. Andy's Place is our 82-unit permanent supported housing complex to serve community members experiencing chronic homelessness and also facing significant complex behavioral health challenges. We were able to build Andy's Place on time, on schedule, and we opened it this past year. I'm very pleased to tell you that Andy's Place is now fully at full capacity. So it did not take long to fill the building. That's how we know there continues to be need for these kinds of resources to be developed into the future. This gives us a lot of confidence that I want to share with you. We know we can do this. Having been able to successfully build Andy's Place, we now know that we can accomplish this phase 2 building with the same level of success. And we're very excited to move that into reality in the future. So beyond the incredible work that happens inside the four walls of the facility, we're also proud that the Broadway Campus Redevelopment is part of the exciting transformation of the Everett downtown core. And it's a transformative shift in the recognition that behavioral health care is central to the well-being of our local communities. Also importantly, this facility will act as a magnet for talented clinicians and support staff. We'll be employing 130 behavioral health and medical professionals there long term. Our capacity and ability to meet the demand for services in the community is 100% connected to our ability to recruit and retain talented professionals to provide that care. We think this facility is going to better position us to be able to bring on those talented staff, have them feel proud to work in this facility, to feel like the physical environment supports the kind of work that we're asking them to do. And so we know that this will really help us long into the future, expand our community and ability to have our doors wide open to serve those most vulnerable community members who need care. So to share more about this community perspective on the project, I'm really excited to introduce my friend, Dr. Gregory Jantz. As many of you likely know, Dr. Jantz is a respected leader in the mental health field. Greg is a best-selling author and has been a pioneer of the whole person care movement. He founded the Center, A Place for Hope, right here in Edmonds, and we are all so fortunate that he is a member of our community. Welcome, Dr. Jantz.
Tom, thank you. And it is good. This is so exciting. I had to be a part of this. I moved to Seattle May 17th, 1980. Who remembers what happened then? Yeah, Mount St. Helens went off. 38 years ago, we founded the Center, A Place of Hope. Just finished my 40th book on suicide and suicide prevention. And I asked Tom if I could say a few words because this is such an important project. One of the things that I wanted to share both as a community member and as a mental health professional is we have challenges before us and we need the work that Compass does. We all know there are the challenges right now. We have the highest levels of depression really that we've ever seen, followed by anxiety and anxiety disorder that Stacy mentioned. And then the third one is addiction. So anytime depression depression goes up and anxiety goes up. We see addiction levels. We're still in an opiate crisis. We still have all these issues that are weighing heavy on our community. And there's other sorts of really deeply debilitating mental health disorders. And Compass, and I have actually visited, toured, got to know the leadership and met team members. So I know firsthand, and I've observed, and we're on the edge here of, we're in a mental health crisis right now in our state and in our country, but we're also just on the tip of the iceberg of what's ahead. We have to have what Compass is doing. Now, there's a lot of barriers to care. One of the barriers to care that we have is there's the unemployment, certainly is the poverty, and the homelessness issue. I mean, we have to mention these. This has kind of put everything in a downward spiral, and we're seeing it. It's visual. I mean, it's visual. We're seeing what's happening, and we have some major challenges that are before us. Now, when I visited for the first time and looked at Andy's place, I've been there a couple times. One of the things that when I left, I go, Compass is the bridge of hope. They're the bridge of hope. And because they're providing behavioral health services to individuals and families that really have few other options that are available. And it's some of the most vulnerable populations. And some of these are, they're on the edge of the social economic margins for our community, and they need our help. So what I observed and what I asked a lot of questions about is just how the outlay of services work. And they've got, and the word that came to my mind was compassionate, successful delivery system. And you can see in this phase 2, as Tom explained, the different levels of care. This is what we have to do. And Compass, you guys do it really well. And there's great outcomes. And the story you heard today is just one of many. So what I'm excited about is to be a part of this, and this Broadway campus, my goodness, this is beautiful. And what it's going to do there, even to the neighborhood. And what we know is doing this is going to help alleviate some of the strain on the hospital systems. People end up in hospitals. I was speaking to a hospital administrator the other day. They're not prepared and they're not able to handle all the pressures that are coming through the ER. And so this is going to be an answer on multiple levels. We know that besides preserving the capacity in the hospitals, it's going to have a great effect on mitigating unnecessary engagement, for example, with first responders and law enforcement. So we're going to be able to address some of that issue. And I'm excited because it's going to change also the neighborhood. And, I'm looking at that. That's beautiful. I've looked at the plans. So let me I just got a couple minutes, but let me just wrap up my comments here. My wife and I met, and we decided we wanted to be a part of this as well. So we made a personal commitment to this project. And I made this commitment because I believe in the leadership of Compass. I'm seeing firsthand what's being done. I know too, it's hard to imagine, but where are we going to be without what Compass is doing and the need? Again, we're on the tip of the iceberg and the need is great. And so the plans here are so timely. I believe in how Compass Health is doing it as well. And you really are the bridge of hope. And so I just want to, those of you that are joining us today, I want to invite you to join me and join my wife, and let's help this along to be accomplished. I'm excited, and thank you for just letting me have a few minutes today to share.
Dr. Jantz, thank you so much. I get the pleasure of working with you regularly, and your excitement comes through, and we're just so thankful that you're involved in this project. So thank you so much for sharing that today.
So important.
Stacy, thank you for being here and talking about and humanizing the individuals that we serve every day. So thankful for that. And Tom, of course, for your leadership and vision around this project. I want to thank everyone, the 120 plus people that attended today. Thank you for taking 30 minutes out of your valuable time to join us. I hope this was informative and gave you a sense of what it is we're trying to do here in Everett. We have a few questions that came in. As I said at the beginning, we will be answering those electronically tomorrow with the recording of this this webinar today. We're also going to include the walkthrough video of Andy's place, so you can get a little bit more detail about what we were able to accomplish this past year. In my haste to start this on time, I forgot to introduce myself. My name is Tom Kozaczynski. I'm the Chief Advancement Officer here at Compass. So it's my team who will be happy to answer any questions that you have. And if we can't, we'll get it to the right individuals. Please feel free to respond to the email that you get tomorrow. We're happy to do that. So again, thank you so much for joining us today. It's 12:30, wrapped up right on time. Really appreciate it. And we will be in touch shortly. Thank you so much.